is that a progression in the sense that, say, peptides might be the least invasive, or whatever term you might use, PRP, Prolo, and then the hydro dissection for nerve stuff is obviously maybe a nuanced thing, but is that the progression that you might work through with the person, depending on what's going on, starting with peptides, like giving them the fundamental pieces they need and work through that way?
Sometimes, yes. Again, each person is going to be so individualized. I say most people who come to me, we are going to incorporate the peptides in with our injections because there's a synergistic 1 + 1 does not equal 2 in a scenario when we're pairing prolotherapy or PRP with something like BPC-157 or thymosin beta-4 or GHK, copper, things like that. Some patients, though, come and they might not be ready for an injection mentally. They're like, look, I know you do a lot of injections. I don't think I'm there yet. I don't want to get poked. I'm afraid of needles, that type of stuff. And those situations, then the peptide therapy can be really helpful. Or if somebody's financially not able to commit to an injection, the peptides are going to be a lower tier therapy, lower cost, right? So that way they can maybe get their foot in the door with that. We see how that does and then move on from there if need be. But a lot of the times I'm actually pairing these things together because they work so well together. And it blows my mind how synergistic they are when we pair them. But sometimes, yes, the kind of the tiering is, okay, let's start with peptides, let's see how you do, and then we go from there. One of the scenarios that happens with sometimes is when I'm working with patients who are not currently in Arizona, but are planning to come to Arizona to see me in the next 6 to 12 months. They might start working with me ahead of time, and we then put together kind of an individualized protocol on here's the lifestyle things, here's the nutritional things, here are the supplements, here are the peptides. Let's do this for X amount of time prior to you coming out. So that way, some of the things might heal and resolve themselves. So that way, when we do our injections, we might need less injections over time or less structures that we need to treat during the actual procedure, because now instead of you having a supraspinatus injury, a subscap injury, and a coracoacromial ligament injury, you might now only have supraspinatus because the other things kind of took care of themselves because the body healed itself and resolved those things because we gave it a better environment to do so.